Did your dentist tell you need root canal treatment? Uh-oh. Is that the best thing for you? Let's dig deep into that. I'm Dr. Mahib Jaouni, founder of Endodontic Specialists and Biorejuvenate Med Spa, a board-certified endodontist practicing in Dallas for over 14 years. Over that time, I've performed more than 10,000 root canal treatments. My mission in this podcast is simple: to break down oral health topics with clarity and real clinical insight so you can understand your health beyond the smile. Today we're taking on a most persistent and honestly one of the most harmful myths in dentistry. The myth that root canal treatment is unhealthy. For decades, there has been a rumor that has circulated that root canal treatment is unhealthy for different reasons. You've heard root canal treatment can trap bacteria, it can cause cancer. You've heard root canal treatment is harmful to the body and poisonous, and you're better off pulling your tooth than having a root canal treatment. These ideas, they sound scary because they're made to be scary. And that's because fearful things spread easily and quickly. But here's the truth. None of those claims are supported by modern science, modern imaging, or modern technology. Root canal treatments are not unhealthy. Let's dive deeper into that. Segment 2. So where did this myth come from? The entire theory came from one dentist. From the early 1900s. Actually, it's just crazy. I mean, how can you take that from one dentist that his name is Dr. Weston Price? He believed that removing the pulp of a tooth left the tooth dead, and therefore it was toxic. Well, we know that if a tooth is filled with bacteria and the nerve is dead in there, then it's going to cause infections, it's going to cause problems, and that's normal for it to happen. However, how can we avoid that? How can we change that? There's a major problem with the theory, and his research was done before antibiotics were even developed, before disinfection protocols were developed, before modern sterilization, before microscopes, before scientific control became standard. So you've got a lot of things that have changed since, and so the whole concept of root canal treatments being unhealthy just goes away. When modern researchers tried to repeat his experiments using the current standards, they found that they couldn't. Their results were simply did not hold up. What actually happens in a root canal treatment? Let's talk about that. Inside each tooth, there's a small space, tiny space, that contains nerves and blood supply, blood vessels. And when that space becomes infected, either through a cavity or a crack, bacteria passes through and contaminates that space. The infection can spread to the jawbone or to the bloodstream if it's untreated. A root canal treatment does one thing. It removes the infection, removes the bacteria from inside the tooth and that space so bacteria does not grow, and then we fill that with the filling material to prevent it from growing back. Modern root canal treatments include using 3D CBCT technology, which is cone beam technology. Allows us to radiographically see a tooth in 3 dimensions, and we're able to identify how big that space is and how unique it is. Each tooth has a different space in it. And the better those spaces are cleaned, the better chances the root canal treatment will be successful because the bacterial load will be less. So there are a lot of nuances to having a good root canal treatment. Microscopes are another thing in dentistry that has helped, in endodontics, has helped us find those spaces and be able to clean them better. Advanced irrigation systems, disinfectants. We use lasers, we use sound waves even to clean the tooth from inside. It's amazing the technology that has come up to allow the tooth to be cleaned up, allow the endodontist to clean the tooth. Bioceramics are a new kind of material that we use to fill the tooth as well, and it seals the tooth well and prevents bacteria from growing. So there are a lot of changes that have happened, and they allow us to obtain a better outcome with root canal treatment. This is not the root canal treatment of 1920, I'm telling you. This is medicine at a microscopic level. Segment 4. Does a root canal treatment increase the risk of disease? Here's where the science speaks loudly. There are multiple large-scale studies published in journals, very well-known journals. Journal of the American Medical Association, Journal of Dental Research, and Nature Scientific. And they all show that root canal treated teeth do not, I'm telling you that, do not increase the risk of cancer, autoimmune disease, or heart disease, or systemic inflammation. In fact, some studies show the opposite. Patients who keep their natural teeth with root canal treatment often have lower levels of overall inflammation and fewer medical complications long term. Why? Because chronic dental infections release inflammatory mediators. Those are things like interleukin and C-reactive proteins. And when you clean out the infection, you lower the body's inflammatory burden. All right, segment 5, why I think this myth won't die. Fear-based theories have a few advantages. They go viral, they feel dramatic, they offer simple explanations for complex health issues. But simple explanations aren't always true. Root canals are one of the most studied procedures in dentistry. If they were harmful, we would see massive patterns of disease everywhere. Everyone will have some kind of an illness because they've had root canal treatments. I've done over 10,000. I've done more than that. And I've seen so many healed root canal treatments. Patients who've come in with infections and they've healed and they've retained their tooth and they don't have any health issues pertaining to that root canal treatment. We shouldn't fear it because the procedure works and it's safe. So if you've ever wondered whether a root canal might harm your health, know this. An untreated root canal treatment with a dental infection poses far more risk and harm to your body than a root canal treatment ever could. My goal with this podcast is to cut through misinformation and share evidence-based tools to help you protect your health, starting with your mouth. Thank you for listening to Beyond the Smile with Dr. Mahib Jaouni. If you found this episode helpful, share it with someone you care about. Click like and subscribe, and I'll see you next time.